Understanding Alcohol Use Disorder, a Public Health Perspective. Hi, I'm Sarah, and I am here with Alpha Immune Nutrition, and I want to discuss a little about alcohol use disorder because it really is a profound part of our reality currently. It's becoming a public health threat. And it's just an important issue. I believe alcoholism affects almost every individual's life in either a direct or an indirect way. So to throw out a little bit of information, over 14 million Americans were diagnosed with an alcohol use disorder in 2019, and that number just continued to escalate during the pandemic. Alcoholism accounts for 140,000 deaths each year and shortens an individual's lifespan by 26 years. Costs related to alcohol-related injury and death contribute to more than $40 billion in economic expenditures annually in the US. What is AUD? AUD is an alcohol use disorder. It is characterized as a brain disease that causes failed self-regulatory behaviors encompassing alcohol consumption. In other words, alcoholism is not under the person's volitional control to abstain from imbibing, and often the individual is entirely unaware of this. Low perceived awareness of behavior makes the individual less likely to see they are addicted. What is considered binge drinking? Just to gauge how much alcohol needs to be consumed in order to be considered a problem. So according to the CDC, binge drinking accounts for 4 or more alcoholic beverages being consumed within a 2-hour time frame for women, and that is 5 or more for men. Alcoholism is so multidimensional and unique in its cause, as well as its treatment plan. And it's based on so many socio-ecological factors, such as an individual's belief system, their experiences, their genetics, their social and familial influences, education, zip code, state, and country. All these things affect the development as well as the treatment of alcoholism. So why is alcoholism so challenging other than, what was just mentioned? Less than 1 in 10 Americans are treated each year for alcoholism. Among those who need treatment but do not receive it, almost 40% said they were just simply not ready to quit. 23% said they didn't know where to go for help to quit, and 20% had no insurance, or they just couldn't afford it, or they had no support system. One factor that seems to relate to all cases of alcoholism is low self-efficacy, or in other words, low self-esteem. Alcohol is still used today as a social lubricant, so that really doesn't surprise me. One factor that also makes alcoholism difficult to treat is the genetic influences. The GAT3 protein on the GABA receptor seems to malfunction in some individuals with AUD, and this causes an entire lack in impulse control. They literally just can't control abstaining. So while it seems there are plenty of options for people suffering from this addiction, there's actually very little understanding about primordial interventions to prevent alcoholism before it begins. If you're interested in learning more about this very important and relevant topic, please visit my website at alphaimmunenutrition.co and visit my blog posts where I actually devised a theoretical framework for understanding alcohol use disorder better. If you found this video useful, please like and share, and please subscribe. Thank you so much, and and have a great day.